I'm Dr. Mark Mason from Southlake Plastic Surgery. Today we're going to discuss some of the facial procedures that we offer at our facility. So a facelift is a procedure that basically turns back the clock, makes you look younger. This procedure is done so that you have a small incision in front of the ear that follows the contours of the ear, so it hides really well. And also there's one behind the ear along the headline, along the hairline that hides well as well. And usually one small incision under the chin to address the neck. So the way the procedure works, the skin's lifted up, in the neck the muscles tightened, and in the cheeks there is no muscle in that layer, but it's a tissue called fascia that's tightened so that it should last hopefully at least 10 years. And then the extra skin is removed at the same time. It is common to do a facelift with upper eyelid and lower eyelid surgery, and even with the brow surgery, because it can be combined during the same procedure and the patient would only have one recovery. An upper eyelid procedure is done if a person has extra skin of the lid that needs to be removed. And it's often done because patients say they feel like they look tired when they're not tired. There's a little incision that's made right in the crease of the upper lid. It hides really well when it heals. Lower eyelid surgery can be done at the same time or separately. In that procedure, a little bit of extra skin is also removed, and usually the fat pockets underneath the eyelid are recontoured or smoothed out to give you a more youthful appearance. A brow lift can be done either along with the facelift like we talked about, or it can be done by itself. Sometimes patients will come in and they just have a very droopy eyebrows and forehead, and that can be addressed alone with what I call an endoscopic brow lift. Some patients come in and they're not ready for a full facelift. They feel like their cheeks look pretty good. They just want the neck addressed. And in those cases, we can do just a neck lift and get a very nice result. In those cases, we just have to make a small incision right under the chin to free up the skin here. And then we don't have to make the incision all the way up in front of the ear, just a little one around the earlobe and back. So it's a little bit less recovery time for a neck lift alone. If you have any more questions about the facial procedures we offer at Southlake Plastic Surgery, we'd love to hear from you.